At this time, it gives me great pleasure to introduce this year's keynote speaker, Dr. Sejal Hathi, Director of the Oregon Health Authority. Dr. Hathi comes to Oregon after serving as New Jersey's Deputy Health Commissioner for Public Health Services. Prior to that, she served in the Biden-Harris administration as the White House Senior Policy Advisor for Public Health. A board-certified attending physician, she also held joint faculty appointments as an assistant professor of medicine at the Johns Hopkins School of Medicine and Bloomsburg School of Public Health. Dr. Hathi was a resident physician at Mass General Hospital and a clinical fellow on faculty at Harvard Medical School. She holds a BS with honors from Yale University and her MD, MBA from Stanford University. Please help me welcome Director Hathi to the podium.
Thank you, Provost. It's an honor to be here. And I don't know if you know, but I couldn't make my own graduate commencement, so it means the world to me to be invited to join yours. Dr. Jacobs, members of the board and faculty, proud parents and families, and of course, the OHSU class of 2024, congratulations. I am so proud of each and every one of you. You know, there are students here who are the first in their families to graduate from a health professional school. Others of you have weathered poverty, homelessness, your own medical illness, and transformed that adversity like alchemists into service. Now you're finally here. You've grabbed your last post-lecture beer at Elephant's. You've heard Dr. Sullivan's last great joke before Oskies. You will hopefully never again have to get rebadged at the Portland VA. And to impart precious words of wisdom, your school has asked a freshly state-licensed 32-year-old doctor who's been running the state health agency for 5 whole months. In case you're wondering, yes, it's a little too late to ask for your tuition back. But aside from being mistaken this morning for your far more brilliant student speaker, I do have the advantage of being somewhat close in age and experience to many of you. And I hope you can hear in my story echoes of your own anxieties and aspirations, and maybe even some useful advice too. It feels like just yesterday that I was in your shoes on the precipice of a grueling residency program, wondering if I were ready, if I had done enough to prepare. Few of us could have predicted that 2 years later, we'd experience a once-in-a-century pandemic. Even fewer of us could have predicted that 4 years later, all of you and I would be here together today. And the truth is, I probably wasn't ready. We will never be as ready as we wish and imagine we could. Not for surviving our first 24-hour call, not for pronouncing our first patient death, not for leading our first clinical team. And yet it's the act of doing that makes us become so. It's the fact of trying that makes us feel so. Commencement, much like any one of these transitions, is about not just remembering all that we've done, but recognizing and embracing who we might become. So whether you're about to be a new doctor, a new dentist, a nurse, dietitian, or pharmacist, thank you for spending some time with me today on your own path to becoming. My journey to the stage began much like many of yours. For 4 years, I studied medicine. I did clinical rotations in pediatrics, endocrinology, psychiatry. I participated in attending rounds, bedside and in hospital hallways. I pored over voluminous pages on the female reproductive system, on hypothalamic circuits, and other aspects of human physiology. Except I wasn't the doctor. I was the patient. When I was 15 years old, I was diagnosed with anorexia nervosa, And in that one moment, with one judgment, my world shattered. I distinctly remember sitting taut on the edge of the hospital bed, the pulse ox flashing 45 beats per minute as the nurse's mouth flattened to a grim line, and he told my parents I'd need to be admitted. I come from a family for whom speaking of mental illness, let alone admitting it in ourselves, was utterly taboo. So for the longest period of time, both my parents and I refused to accept my diagnosis. It was my team of providers, my pediatrician, my nutritionist, my nurses, and my therapists who reeled me from that abyss and gave me back my dignity. They reminded me that I was more than this disease, that there was not shame, but freedom in accepting help, and that while we live in a society that conditions us to believe we're not enough, not good enough, not smart enough, not perfect enough, we still can be whole. So I made it my dream to pay it forward and commit myself not just to pursuing medicine, but also to fostering a sisterhood of changemakers, which could train and equip girls just like me to inhabit our own power. What I began that summer as a project to aid my own recovery blossomed into a global organization, mobilizing and mentoring less than 6 years later more than 30,000 young women to create social change. Commencement speeches are supposed to share lessons, so here's my first. Turn your pain into purpose. Many of you have no doubt experienced already hardship, disappointment, failure. In the coming years, you'll encounter more. You might lose out on a fellowship you badly wanted. You might lose a patient. When these setbacks inevitably strike, all you can choose is how you handle them, whether you succumb to despair or you rebaptize those failures as something more. I wish I could tell you there's a brilliant trick for doing this. There's not. But let me remind you, many of you began your studies during a global pandemic. In-person classes were canceled, hospitals were overwhelmed, public health was a partisan football. And instead of hosting commencement, this very convention center became a temporary, socially distanced, homeless shelter. Still, through the fear and anxiety and grief that consumed that period, you persevered. You organized immunization clinics and volunteered for the street nursing team. You doubled down on your studies and you built community. You turned pain into purpose. For me, it was about looking outward rather than inward. Instead of counting every calorie and poking at every physical flaw, I began to fixate on the world's defects, like how society marginalizes and penalizes women and girls, and channeled my energies into healing them. First, social entrepreneurship, then medicine, gave me an outlet to turn all that negativity into something meaningful, even beautiful. The legendary poet, Taylor Swift, put it this way: rain came pouring down, but when I was drowning, that's when I could finally breathe. Transcending your darkest moments isn't easy, but sometimes the road to meaning, to purpose, to clarity, it runs through pain. Use that pain. Reclaim those hardships as vessels for your potential. When you're drowning, breathe. Now, don't be surprised if sometimes charging forward in this way rankles those around and above you. Especially here in the world of health and medicine, we can erect towers of groupthink and rigid hierarchies that deter, even ostracize, unorthodox choices. But when that happens, lesson number 2, don't be afraid to step out of line. Here's what I mean. About halfway through my first year of med school, the then UN Secretary General appointed me to his advisory group, guiding and evaluating global progress on women's health. The role required me to travel every few weeks, meeting everyone from health ministers in Geneva to doctors in Malawi. I thought it was an incredible honor. To me, this was what being a physician was all about: advancing the health of some of the world's most vulnerable populations, harnessing my voice and my training to bring global attention to their needs. But at the end of my first year, a senior faculty member sat me down for a formal disciplinary meeting. She told me I was not showing myself to be the kind of student they wanted at their school. I was missing lectures, failing to participate in after-school extracurriculars, absenting myself from the campus community. This professor more or less told me I had to choose. I could be a med student or I could be a global advocate, not both. I could pass my final exams or travel the world, not both. I could position myself for a good residency or try to move mountains at the UN, not both. I was shocked. That chip on my shoulder, it grew to about the size of Mount Hood. Because even with my heavy travel schedule, I had kept up with my studies. I had passed my live-streamed classes. I was confident that I could both be a med student and advise the UN. I also believed that what I was doing mattered, that it was enriching, not distracting from my training, that it would maybe even save lives. And wasn't that the point of medicine? So I refused to choose. I continued to travel and speak out and organize. I passed my exams and my clerkships with honors. And when I matched with my top choice residency program, I may have emailed that administration leader and thanked her, ever so sincerely, for what I know was well-intentioned concern. Telling this story now, I have the benefit of knowing that my decisions didn't derail my career. But in the moment, going against the grain, stepping out of line, can be terrifying. That's particularly true when you're the only one in some exclusive space that looks like you, or is as young as you, or is the first in your family to attain some goal, and yet you depart from what that community holds up as the gold standard of success. Defying a superior, particularly one with influence over my residency interviews, it wasn't the easy choice. It might even have been an extremely dumb choice. But for me, in that moment, it was the right choice. And it might be the right choice for you too. Just because someone is more senior or more credentialed or even more ostensibly successful than you, don't let them put you in a box. Don't let them tell you what your place is. Don't let them dictate how you live your life or you make your career. If you believe you're doing something meaningful and valuable, do it. The authority figure that matters most in your life is you. And if you're thinking about defying authority and convention, I have a final piece of advice. Get into the public arena. Care for the health of our body politic as fiercely as you care for the health of your patients. And I'm not just talking about the epidemiologists graduating today. I'm talking about people like 19th century doctor Rudolf Virchow. You all may know Virchow as the pioneer of cell theory, the pathologist who defined deep vein thrombosis, the reason many of you memorized the classic Virchow's triad. But he was also the founder of what we now call social medicine. And when typhus swept through Prussia in 1848, it was the 26-year-old Virchow that the king sent to find its cause. So he did. In a now landmark public report, Virchow concluded that the epidemic of typhus fever was caused not by infection or disease, but by poverty and social inequality. The single most effective cure, he proclaimed, was free and unlimited democracy. Two centuries later, COVID once again laid bare the fragility of a system that excludes whole communities from power. The poorer you are, the likely sicker you are. The sicker you are, the likely more disenfranchised you are. As Virchow famously declared, politics is nothing else but medicine at a large scale. Yet even now, in the pandemic's wake, I worry our professions are not picking up this gauntlet. Out of 535 sitting members of Congress, just 33 are health professionals. That's 1/6 of the body's lawyers. Fewer doctors volunteer or attend civic meetings than the general public. And for more than a decade, studies have found that health professionals of all stripes, nurses, pharmacists, physician assistants, dentists, vote at a lower rate than any other professional class. Now, I know in recent years, our colleagues have become more comfortable considering the forces that shape health outcomes, what we now call social determinants of health. But what determines those social forces? Who can afford insulin? Who lives in neighborhoods choked with pollution? Is our political system. And as stewards of our patients' health, it's our responsibility not merely to treat disease, but to decry and redress the broader structural barriers to their well-being, to fight for policy that advances health equity, to uphold a free and unlimited democracy, to practice medicine on a large scale. That's the reason why, in the throes of COVID, I partnered with fellow residents to register over 6,000 hospitalized patients to vote, and why I'm proud today to serve as OHA director, working to democratize health for all Oregonians. I know politics has becoming exceedingly ugly and divisive. After a 30-hour shift, showing up at a town hall, writing an op-ed, or running for state legislature is probably the last thing any of us want to do. But we need you to do it anyway. The Black women who are 3 times more likely to die in childbirth than others, they need your voice anyway. The children in rural Southeast Oregon with higher cavity rates than the rest of the state, they need your voice anyway. The families watching private equity firms take over their hospitals, their dental clinics, the primary care clinics that they depend on, they need your voice anyway, because your voice is far more powerful than you may realize. One of the people that taught me the impact of a single voice was a young boy named Matty Stepanek. This is the last story I'll share with you. Matty lost all 3 of his siblings to a rare neuromuscular disease. 20 years ago this month, Matty lost his own life. For most of us, suffering what Matty did, tremendous loss, feeding tubes, a tracheostomy, disability, it would have been easy, even expected, to be consumed by bitterness and despair. But this courageous boy, who in his limited 13 years of life endured more pain than thousands, staunchly refused to yield. And in his own impregnable hope and faith, he inspired millions to champion a better humanity. Matty published 7 best-selling books. He became an acclaimed, prolific poet and National Goodwill Ambassador for muscular dystrophy. He wrote, "I am spending my time on earth before death, living rather than dying, and not wasting a moment of the precious gifts of time and of life and of being for now." Matty taught me that how we elect to reach out and touch the world is how the world will reach back and shape us into the future. And so we must choose to play after every storm. We must choose to transcend our differences. We must choose to fight for something larger than ourselves. Class of 2024, what are you going to choose with this one short and special life of yours? What are you going to fight for? What are you going to transform pain to purpose for? You're not just entering a profession, you're joining a larger calling, a covenant of caregiving. And no matter where you go or what you do, you'll forever be lifted up by this community, this institution, and the people here that you served. So, OHSU, get out there. Heal, lead, advocate, build a better future for us all. And don't be afraid, when necessary, to ruffle some feathers. Congratulations, class of 2024, and Godspeed.